Hello, good evening. If the end of 2022 feels like it's buckling under the weight of industrial action across the NHS and large parts of the transport network, then as it stands tonight, 2023 is not looking much brighter. 2 more days of ambulance strikes have been announced across much of England for the new year, and nurses are warning they too plan to walk out again. The government, though, continues to refuse to talk pay, as Libby Vina reports.
An emergency service meant to help people at times of crisis, now facing a crisis of its own. After yesterday's action, the first in over 30 years, more strikes are looming. The Health Secretary is refusing to talk about pay. Union officials say it's the only way to break the deadlock.
What we're asking for them to do is to commit now to hold proper pay talks about boosting pay this year so that we can start reversing some of the enormous pressures that have built up through having so many unfilled vacancies, through having so many staff who are leaving.
Unison's action will involve ambulance staff in London, Yorkshire, the North West and North East, as well as the South West of England on the 11th and 23rd of January. Before that, paramedics and call handlers from the GMB union will take action across England and Wales next Wednesday, while the Royal College of Nursing is tomorrow expected to announce further strikes for January. Tonight, the Health Secretary said it was disappointing some union members were taking further action. Earlier, he hinted a better deal might be possible next year, but union leaders say the dispute is over this year's pay offer, and NHS managers seem to agree.
This industrial action, as we understand it, is about this year's pay offer. It's not about negotiating for the future. And I think that what we've got to see is the government coming round the table to talk about pay.
But ministers say it's not their job to negotiate directly.
You cannot have an independent pay review process which takes the politics out of pay and then have politicians intervening in that process. Not only does it blow the process up and destroy the process, but it also means what happens in future years.
Can that position hold? Ministers seem to think so. There were some more conciliatory words from the Health Secretary today when he tweeted that he was grateful for the work of ambulance staff. But it doesn't look like that gratitude is going to translate into a better pay offer, and these strikes now do look inevitable. Add to that the fact that the Royal College of Nursing tomorrow will announce there'll be more strikes by its members, and it looks like that the new year will see more disruption right across the health service.
OK, Libby in Westminster, thank you.